Welcome to the Resources for Integrated Care webinar series on member engagement. This podcast is excerpted from a webinar presented live in the summer of 2015 called Training Consumers for Engagement, Developing a Curriculum that Empowers Members. This webinar series is presented by the Lewin Group in collaboration with Community Catalyst and is supported through the Medicare-Medicaid Coordination Office in the Centers for Medicare and Medicaid Services. MMCO is dedicated to ensuring that beneficiaries enrolled in Medicare and Medicaid have access to seamless, high-quality health care that includes the full range of covered services in both programs. So to support providers in their efforts to deliver more integrated, coordinated care to Medicare and Medicaid enrollees, MMCO is developing technical assistance and actionable tools based on successful innovations and care models. To learn more about current efforts, please visit resourcesforintegratedcare.com. In this podcast, Margo Michaels, the principal of Health Action and Access Consulting, shares best practices for trainings to maximize the time spent in member advisory committee meetings.
I want to start off by talking about the importance of curriculum in ensuring that we have meaningful and quality consumer engagement. I think everyone here knows that it's easy to fall into a pattern of just having meetings because we need to have meetings rather than having meetings because we want to have meaningful engagement and input. And so underlying this entire curriculum and the training initiative is to empower consumers to feel engaged and to feel that they have an important role at the table and that they're not there to just listen, but they're there to engage and to help plan and to help see the impact of their input into different changes in the plan. When we started to develop the curriculum, the first thing that we had to do, of course, is to figure out what was important to include. And that included talking to key informants, folks that were involved with different plans, both in Ohio, where we did the pilot, and nationally. We also had folks who had been integrated into these kinds of initiatives review the outlines and the content that we came up with. We looked at the literature that was out there. And we also applied the principles from the toolkit that Bill just talked about. The philosophy, as I mentioned, is that we want to focus on changing behavior and changing attitudes with a focus on action. The idea of meaningful engagement, again, is not to sort of be grateful that one is on a committee, consumer advisory committee, but rather that one is providing insight. And built into that is obviously building confidence, since many of these folks have not had any experience in working on these kinds of committees. We want to make sure that we instill a sense of confidence and also a sense of their own skill and qualifications in being members of this important initiative. The other things that we need to focus on, too, of course, is nice to know versus need to know. This is critical because as policy people and as people that care about this, we want to shove as much information as we possibly can into a training. And this is something we have to constantly fight ourselves with. But as those of you who know who engage in these kinds of programs, we've got to curtail ourselves and realize that more is not necessarily better, and that we need to always be asking ourselves, do people need to know this or do people want to know this? Excuse me, I'm sorry. The final thing is that we want to make sure things are participatory. And the meaning of that is that we don't want to sit and have slides be presented over and over again and then have lunch and then have people go home. We want to have people participate and try things on for size during a training program. Next slide. So when we think about the objectives that we came up with, and again, these were iterative over time as we continue to develop the curriculum, there were a couple things that were important for us to make sure that we had in there. One was people had to have a sense of what the demonstration projects are about, that this is not just something unique to their state or unique to their plan. This is something that's going on nationally, and they're part of a national consumer movement. Second is that we wanted to give them a sense of what consumer advisory councils or committees are and what that means for the benefit of their plan and the benefit of the people, of care people in their community. Another thing is that we had here is we wanted to make sure that people had an ability to be able to talk about their own concerns and hopes. This is really important because many of us sort of hold those fears, especially to ourselves, thinking things like, I can't possibly contribute, or I don't know what I'm doing, or I've never been to a meeting like this before, never recognizing that actually a lot of those concerns are shared. And also what hopes are, and those can be realistic hopes or unrealistic hopes, and by sharing those in a room that can actually help to make it clear what we can do. So for example, universal health care might be a hope that all of us want, but that is not sort of a realistic expectation of a consumer advisory council. Next slide. Then we wanted to get into some nitty-gritty about meetings. Again, some of these folks may have been comfortable being in a formal meeting situation, some of them may not, but we wanted to really provide a lay of the land about how these meetings take place, how they work, what the purpose is, how they need to prepare for them. And we wanted to also give a sense to them about what could be effective in a CAC meeting, and what could be less effective. And you'll see when I give you some examples that was a very interesting activity for them to think about, because I don't know if many of them had thought about, well, gosh, is this really a good use of my time or a good use of all of us sitting here around the table? And finally, I wanted to give a sense to them about the importance of the feedback loop. So again, these meetings and this committee is a part of their plan's administration and a part of their plan's policies and procedures that is not just limited to them in that room or the people that are sitting with them in that room, but really part of the plan's leadership, and that kind of feedback loop has to be constantly fed and reiterated. Next slide. We also let folks talk about what are the qualities that effective CAC members have. Again, we could have sort of just listed these in a slide and have everybody nod and then move on to the next section. But we engaged in a number of activities to help them think through what this means, what this would mean to them personally, what this would mean to them as their particular committee, and also what they think is important. Now, what I might think is important may not be what they think is important, but really coming up with a group understanding of those important qualities, and then really getting a sense of where their strengths and weaknesses are, not as a report card, but as a sense for them to think about, oh, wait, I really need to improve on that, or I don't really need to improve much on this. And of course, all of us need to improve in various areas, whether we're experts or whether we are newbies at a particular activity. Next slide. So I want to share with you just two examples of activities that we did to get at some of the objectives that I mentioned. The first on the left side are cartoons of two different kinds of conversations. One is talks about a van picking the person up late, and now I can't see my doctor, and I'm angry. What should I do? And on the right side was the same person, but instead of talking about himself, is saying, I wonder how many people miss their appointments because of transportation problems. Juxtaposing these two situations was really helpful for the group, and John will be talking more about what we got to as a result of that conversation, but helping people understand the differences between a personal support group and understanding how my issues really are only important in far as this committee goes as it relates to other members, and really understanding that the collective responsibility is more important here than the individual responsibility. On the right-hand side, I've copied an example of one activity we did called Meaningful Agendas or Not. And we did this in small groups where the group had to take a look, each small group had to take a look at one of these agendas and see, do you think the plan is seeking meaningful feedback or not by an agenda like this? And what would you change? And there was a lot of aha moments in the group, both in small groups and large groups, about, wow, I never thought that this might not be an appropriate use of my time because I'm being talked at for 2 hours rather than, being engaged with. And other people said things like, wow, we should really be involved in forming an agenda rather than just receiving an agenda. So these are just 2 examples of activity that I wanted to share with you. Next slide. The materials that we provided were pretty comprehensive. We provided a trainer's guide to the trainers. I was one of them, and John was one of them. And John will talk more about his experience being there. But that was able for anyone to be able to pick up this guide and be able to be a presenter of this material with the idea that that person is not an expert, but is actually a facilitator for group discussion based on key activities. We had a workshop guide that was for consumers that was short, wasn't duplicating all the slides as we often do, but actually really focusing on key points, activity sheets, etc. And this is the agenda. As you can see, it went from 9 to about 4. It was a tight day, but it also was, and a long day, but it was also a day that I think was very energizing. I think this could also work as two shorter days rather than one long day. Next slide. We also did, as every good trainer should do, we did an evaluation at the end of each training. At the training we did, and because most of our group had literacy challenges, we wanted to use smiley faces and frown faces. In the middle was sort of neutral faces, meaning okay, well. And so as you can see here, this is a summary of our scores, and you can see where there's a sad face and there's no score. That's actually good. That means that we had very few sad faces in the room. And you can see that most people were actually in the well or very well category, and looking at sort of how well that they feel they can now do these things. This is obviously self-report. And I'll show you on the very bottom here about how prepared do you now feel to be part of the CAC, and you can see that that was well and very well. We would like certainly to do that as a pre-post to really get a sense of how people's assessment might change pre and post. Next slide. When we asked some qualitative feedback, we got some positive results there as well. We found that people enjoyed the participatory aspects of it. They were also provoked into thinking about new kinds of things like goal setting or parking lots that were things that they had not thought of. And as a result of this training, there were several people that became more vocal, and John will talk more about that in a second. But we saw even those changes in the room while we were there.
For more information about this webinar series and other resources, including videos and podcasts, please visit resourcesforintegratedcare.com and follow us on Twitter at integrate_care.